Today we're talking about heart health with our 9 News health expert and resident cardiologist, Dr. Payal Kohli.
So, Dr. Kohli, we're going to do some rapid fire here, fact and fiction when it comes to preventing a stroke.
Yeah.
Right? So let's start with this one.
Yeah, having a stroke can be prevented. Fact or fiction?
That is a fact, guys. And most people accept that as a it's going to happen to me. It's inevitable. If I have a family history, I'm going to have it. But data tells us up to 80% of strokes can actually be preventable. And stroke, as we know, is one of our most feared outcomes as we age. The other one, dementia, up to 50% of cases of dementia preventable with the right risk factor management. So I hope that inspires you to think about your risk as you get older and do the right things to prevent it.
Absolutely. Sometimes people think there's nothing they can do. It's inevitable. There's this as well. Once you've had a stroke, there's not much you can do to prevent another one because oftentimes you do have another one. Is that fact or fiction?
You do have a target sign on you when you've had a stroke for having another stroke.
Right.
But the good news, you can prevent that.
Really?
So that is fiction. You can prevent a second stroke, not just with the lifestyle changes, but also with certain blood thinning medications that can prevent it. Now, think about our brain. What does our brain feed off of? A giant network of blood vessels. So anything that we do to keep those blood vessels healthy doesn't just help our brain, it helps our heart as well. And in fact, new studies are now telling us that certain diets may be associated with a lower risk of having not just a heart attack, but also having strokes. And this is the Mediterranean diet. Most of us are familiar with this diet, but if you're not, type it into your favorite chatbot. It'll tell you what to do. Cut down the red meat, the processed meat, don't smoke, eat lots of fruits and vegetables, make sure you have those whole grains, make sure you have the fatty fish. All of that put together can actually be associated with a lower risk of stroke.
Hummus and pita involved in the Mediterranean diet because I really like that.
Yeah, pita and hummus. How about that? Okay. Spicy hummus with garlic, because garlic is good for your heart.
Now that I can get on board
and
with.
Nuts. I love nuts.
Yes.
That's on there
and nuts. Nuts are great. Nuts are the right type of fat. What I say to my patients and to myself whenever I'm snacking on nuts, make a little tiny pouch of nuts, because if you just keep reaching into the container,
then
it
gets away from you.
Too many.
It's like potato chips. It's easy to.
It is. I love nuts.
Vaccines are associated with a reduced risk of stroke. Fact or fiction?
Yes, fact.
Really?
New
This is
data,
surprising.
hot off the press from the American College of Cardiology meeting earlier this year that tells us that the shingles vaccine may be associated with a lower risk of having stroke. So they looked at 275,000 people who got it, 275,000 who didn't, and the ones who got it had a lower risk of stroke. Now remember, this is an association, not a causation. So it could be the people that got the vaccine were doing something else also that might have led to a lower risk of stroke.
Significant?
But the numbers are very significant, Phil. And not only are the numbers significant, we think the mechanism could be decreased neuroinflammation. And we know that inflammation is a big driver of stroke. We know that getting the flu shot is associated with a lower risk of heart attacks. And so as a cardiologist, I tell my patients one of the best ways that you can prevent your next heart attack after having one is getting that annual flu shot. Because again, there's the inflammation, there's the infection, all of those things can drive risk.
So this last one, in the last 30 seconds or so that we have, stroke only affects the brain. I think a lot of people think this is where you have a stroke, but it affects other places as well.
It affects the entire body because our brain is our master computer. Now, people can have silent strokes and not realize that it affects a tiny part of the brain or a part that doesn't make our hands move or what have you. But we know that stroke is a total body illness. We also know that stroke can be devastating, like I said. So it's really, really important for us to make sure that we do everything to reduce our risk of having a stroke. Now, if you have symptoms and you're worried about them, the last thing you should do is ignore them, even if they go away. Because sometimes people have something called a TIA, transient ischemic attack, which is a stuttering stroke about to happen. And we know that if you ignore that, it could lead to a big stroke. And people think stroke's all about cholesterol, but it can also come from atrial fibrillation and high blood pressure. So keep an eye on your risk factors. Figure out what you can do with your heart health, your blood pressure, your cholesterol, your blood sugar, your diet, your exercise, and reduce your risk.
It's all related, right?
It's all related. We
all...
got to age better, guys. It's all in our control.
We're trying, okay? You're helping.
Because there's no stopping it to begin with. So thank you, Dr.
Kohli. Yes.
Doctor, thanks.